Hello, my name is Shane Ryan and I would like to welcome you to this series of webinars presented by WASABA on the importance of humane management and animal welfare in Rabies Elimination Program presented on World Rabies Day 2020. Rabies is completely preventable by vaccination, and yet every year an estimated 59,000 people die from this disease. And canine-mediated rabies accounts for some 99% of all human deaths. However, elimination of rabies is possible and it may be achieved through the vaccination of dogs and the prevention of dog bites. To achieve the elimination of rabies, to end human deaths from dog-mediated rabies, a collaboration called United Against Rabies set up a program called 0 by 30, a global strategic plan. The partners in this collaboration being the OIE, the FAO, the World Health Organization, and GARC, the Global Alliance for Rabies Control, of which WASABA is a partner. And to help to achieve this elimination, the collaboration has developed a theory of change, represented here, which is built on three pillars: occupational capacity building, education and advocacy, and monitoring and evaluation to ensure effectiveness and sustainability. And in the webinars today, we'll be looking at a few areas covered here, including the effectiveness of vaccination, which includes vaccination coverage and reaching the target population, responsible dog ownership, and implementation of dog bite prevention strategies and dog population management. An effective dog vaccination program certainly needs efficacious vaccines that produce the required immunity, which hopefully will be of long duration. And the program must also ensure sufficient herd immunity, both by the coverage and also access to the target, to the susceptible population of dogs. And an effective dog vaccination program must also consider the animal welfare aspect. Humane handling of the animals during a mass dog vaccination program to make sure that it is a positive experience not only for the animals but for the owners and the community is essential to ensure stakeholder support. And considering herd immunity, which is the vaccination threshold, some of the considerations that have an animal welfare aspect is we need to keep these vaccinated dogs alive, decrease population turnover through efforts such as sterilisation, dog population management. The lower the population turnover, the slower the decline in vaccination coverage over time. We have invested in vaccinating these dogs. It is a very good idea to keep them in the dog population for as long as possible. And considering the target population, we need to obviously vaccinate the animals that are most likely to encounter rabies virus, which are dogs that are not enclosed, dogs that are roaming, dogs that are stray dogs. However, if vaccination rates of own dogs are too low, then no amount of effort vaccinating the stray dogs will be able to control or eliminate rabies. And just before I introduce our speakers, I'd just like to touch upon the role of veterinarians in rabies elimination programs as vaccinators or training vaccinations, public education, which we can do as either individual private practitioners or through various educational portals, reducing turnover, helping and assisting with dog population management programs, sterilisation and spay programs, helping with surveillance, and the animal welfare associated with not only dog population management, also capture, restraint and release, if that's appropriate, of vaccinated dogs into the community. While the role of veterinary association is complementary to that of practitioners, mainly to coordinate with the individual veterinarians, whether private practitioner or not, veterinary practices, and the NGOs and the government authorities are involved in rabies elimination programs. And so to our webinars. We have two today. They are pre-recorded, but both have a live question and answer session at the end. Our first speaker will be Dr. Matthew Stone, the Deputy Director General of the OIE, to be followed by Dr. Sarah James from GARC, the Global Alliance for Rabies Control, Dr. Natasha Lee, who is the incoming chair of the Wasaba Animal Wellness and Welfare Committee, Dr. Ray DiNapoli from the Philippine Animal Hospital Association and ex-country director of Humane Society International, Dr. Luke Schumann, who is the Chief Technical Advisor from the FAO ECTAD Indonesia, and then the live question and answer will be Dr. Sarah James and Dr. Lee. For our second webinar, we will have Dr. Matthew Stone from the OIE talking about dog population management programs and responsible dog ownership. Then Professor Sarah Cleveland from the Wasaba One Health Committee, who is also Professor of Comparative Epidemiology at the University of Glasgow. Dr. Melania Gamboa from World Animal Protection, the Veterinary Programs Manager. Dr. Rahana Atingo, who is a Wasaba member representative from the Veterinary Association of Namibia. And then the live question and answer session with Professor Cleveland and Dr. Gamboa. So now I'd like to pass you over to our first speaker of this afternoon, Dr. Matthew Stone, the OIE Deputy Director General for International Standards and Science. Thank you.
Hello everyone, my name's Matthew Stone. I'm the Deputy Director General of International Standards and Science at the OIE, the World Organisation for Animal Health. Firstly, thank you to Wasaba for the opportunity to present on this occasion of World Rabies Day at the World Small Animal Veterinary Association's seminar in relation to rabies. I'm going to talk you through some of the OIE initiatives in particular, just starting with a bit of an overview of the 0 by 30, the global strategic plan to end human deaths from dog-mediated rabies by 2030. Which is a collaboration between OIE, the Food and Agriculture Organization of the United Nations, the World Health Organization, and the Global Alliance for Rabies Control. And this ambitious strategy has three clear objectives, which are to effectively use vaccines, medicines, tools, and technologies to reduce human rabies risks. Objective 2 is to generate, innovate, and to measure impact, and that's through providing guidance and data. And Objective 3, to sustain commitment and resources. And to do that, we need to harness a multi-stakeholder engagement. And this ambitious plan is in three broad phases: start-up, scale-up, and mop-up. We've also just last year, in fact, produced the first annual progress report, which contains a wealth of information, country stories, progress reports. You'll find interesting diagrams such as the one that's presented on the right-hand side of the slide here that provide an overview of the human, animal, international standards related to rabies control, covering everything from surveillance, case definition, diagnostic surveillance approaches to prevention and control, vaccines, vaccine manufacture, vaccine production, and the approach to elimination. So a wealth of information there in the 0 by 30 annual report. I recommend it to you and provide you with the link just there. What I'd like to focus on, because I think this will be of great interest to Wasaba members, is the work that the OIE is currently doing on the international standard for dog population management. And currently in the OIE Terrestrial Animal Health Code, in the animal welfare section of the code, we have Code Chapter 7.7 on stray dog population management. But in fact, what this new standard does is it introduces a much more holistic approach to improve the welfare of dogs and, of course, their harmonious coexistence with humans. And importantly in there, there's also a lot of information that promotes responsible dog ownership. With the substantive work that we've done in terms of improving the standards for rabies control, this updated chapter will integrate better with the rabies chapter. Dog population management is an important contributor to rabies control programs, and that is through reducing population turnover, supporting the maintenance of herd immunity through vaccination programs and ensuring that they're sustainable. And very importantly, this chapter recognised the broad roles and responsibilities across competent authorities, other government agencies, including those related to education, municipal authorities as well. Local administrations obviously have a significant role to play in dog population management. Of course, the broader veterinary services, including private veterinary practice and clinical services, and the role of civil society in terms of the non-government sector, which is very important in rabies control internationally. So this updated chapter, it's just completing its drafting process, and we'll be moving to the typical 2 rounds of consultation through our members. They are the government veterinary authorities of the 182 member countries of the OIE, and we hope and expect that those government veterinary authorities are reaching out to the stakeholders in their national communities to achieve a well-rounded view as we move through the consultation phases. Okay, I'd also just like to very quickly cover off some of the other important initiatives in this whole program, the United Against Rabies program. This year for World Rabies Day, the partners in United Against Rabies, WHO, FAO, OIE and GARC, will be launching the United Against Rabies Global Forum. And this is a broad partnership platform for coordination and collaboration. We really need to recognise that there are so many partners in terms of international rabies control, and providing a forum to bring those partners together, to share best practices, to share information, to facilitate collaborations at national, regional and global levels is very important. The OIE this last year, in fact, has introduced a new system whereby countries can apply for official recognition of their programs for rabies control. And we expect that the first dossiers will be submitted for evaluation this year, and through our expert group processes that will result in, we hope, members being put forward for recognition of their official control programs for rabies by the OIE World Assembly next year during the general session in May 2021. We've also been seeking high-level One Health commitments for rabies control. What this entails is the 3 international organisations, WHO, FAO and OIE, lobbying at ministerial level, so the ministers are involved in public health and animal health, to make a national commitment towards rabies control, and that's bearing fruit at the moment. We've had a number of countries signing ministerial level declarations around rabies control, and that's going to push the agenda forward, we hope. We have achieved resource partner funding for national action plans in several countries, and there in recent you'll find on the OIE website, and in fact in the annual report that I mentioned before, some really good country stories about national funding and resource partner funding towards national action plans in a number of our countries. In the public health sector, there's been a significant boost recently with Gavi announcing funding for post-exposure prophylaxis through public health authorities, and we're looking to piggyback on that by ensuring that on the animal side, we are able to seek resource partner funding for the animal health controls that unfortunately aren't able to be funded through the Gavi mechanism that is purely focused on public health and therefore post-exposure prophylaxis. But the OIE Rabies Vaccine Bank is continuing to make important strides, now up to over 25 million doses distributed thanks to the support of our partners. And of course, that is driving the approach of mass vaccination of dogs towards ending human deaths by dog-mediated rabies, we hope, by 2030. So I hope that's given you a bit of an overview, a bit of a flavour. The focus on dog population management is something new for the OIE, and watch out for that international standard. I wish you all a fruitful and successful and collaborative World Rabies Day 2020. Thank you.
Good afternoon. On behalf of the Global Alliance for Rabies Control, I would like to thank the World Small Animal Veterinary Association for organizing this webinar. I am Dr. Sarah Jaime, the Asia representative of GARC, and will present on the importance of collaboration and vaccination as essential tools for the final goal of rabies elimination. For this presentation, I will discuss the importance of intersectoral collaboration to strengthen rabies strategies, highlight the importance of dog vaccination and ensuring their welfare in controlling rabies, as well as the different ways to share live messages on rabies. Website links are also added in some of the slides for more information about different topics. The Global Alliance for Rabies Control works with governments, veterinary and public health experts, educators, and communities to eliminate rabies in areas hardest hit by the disease, to protect people from terror, poverty, suffering, and death caused by rabies, promote healthy relationships between people and dogs, and to alleviate the burden of the disease in animals in general. We would like to emphasize that vaccinated dogs are the best allies in the control of rabies, and it is better rather than culling. It is estimated that every year 59,000 people die of rabies globally, wherein 40% are children. Every 10 minutes, one person dies of rabies. It can be an 8-year-old child whose mother is on the left side of photo, who was bitten by a non-vaccinated dog and was brought to a traditional healer instead of the health center. These are just one of the examples. We know that vaccinating dogs is the most cost-effective way to control rabies. It has been proven also that combined with post-exposure prophylaxis in humans, it can greatly reduce rabies cases both in humans and dogs. For this to be successful, it is important that there is a One Health approach or intersectoral collaboration in planning and implementing rabies control programs. At the global level, the World Health Organization, Food and Agriculture Organization of the United Nations, World Organization for Animal Health or OIE, and GARC created a country-centric multi-stakeholder collaboration called United Against Rabies. The United Against Rabies worked together in developing the 0x30 Global Strategic Plan, which encourages countries to lead elimination efforts. National strategies are also essential in the fight against rabies. Together with other partners such as FAO and US CDC, GARC developed the stepwise approach towards rabies elimination. It is a self-assessment tool for program managers from the health and veterinary sectors, together with other government sectors and private sectors, professional organizations, to evaluate the rabies situation, use it as a basis in creating or developing their work plans, implement it, and track their progress. It is composed of 7 components such as prevention and control, data collection and analysis, dog population issues. The STAR tool is answered by yes or no and provides links for more information per activity. One of the main links of the tool is the Canine Rabies Blueprint. It is a user-friendly, web-based question and answer document, consists of contributions from numerous experts working in the field of rabies. It provides hyperlinks to more detailed information and documents, as well as case studies of best practices. Rabies as a transboundary zoonotic disease needs collaboration between countries. GARC serves as a secretariat for regional networks in Africa, Asia, and the Middle East. It provides a venue for medical and veterinary representatives from different countries involved in rabies programs to discuss cross-border issues and look for solutions. At the national level, intersectoral rabies committees are important to lead the Rabies Elimination Initiative. In the Philippines, the National Rabies Prevention and Control Committee is chaired by the Ministry of Agriculture and vice-chaired by the Ministry of Health. It is mandated by a policy under the Republic Act 9482 or the Anti-Rabies Act of 2007. Other agencies includes the Ministry of Education, Interior and Local Government, Environment, professional organizations, universities, and NGOs such as GARC. One of the landmark activities of the committee is that in 2014, the Ministry of Health donated more than $1 million to the Ministry of Agriculture to buy animal rabies vaccines. In the fight against rabies, a vaccinated dog needs to be seen as the hero and not the villain. For this to happen, it is important that collaboration happens in tapping expertise of other organizations to train field personnel on humane handling of dogs, proper vaccination techniques, and cold chain. For the GARC project sites, we collaborated with Humane Society International in the Philippines and FAO in Indonesia for such trainings to ensure that rabies vaccination is a positive experience for both dogs and their owners. We tapped and trained health workers who usually involved in maternal and child health in the area to support rabies vaccinations as community mobilizers and data recorders, since they have built rapport already with the community. To increase capacity and encourage more rabies champions in the community, we offer free online courses such as the Rabies Educator Certificate, which serves as the base course, and there are also professional specific courses after taking the REC, which includes 4 dog vaccinators and animal bite centers. There are also courses for community coordinators to assist in the information campaigns and vaccination campaigns. Currently under development is the course on animal welfare. Rabies Educator Certificate provides an overview of what rabies is as a disease, on bite prevention, and responsible pet ownership. The course on animal handling and vaccination, on the other hand, tackles topics on understanding animal behavior, effective ways to approach dogs, and the different equipment needed. The course preferably requires a hands-on training. Certificates are also provided after completing each course. To train future veterinarians, we've also collaborated with veterinary universities to include the online courses in their curriculum as part of their internship training programs. Aside from capacity building for dog vaccination, high-quality vaccines need to be available and ensured. The OIE vaccine is a program that provides quality vaccines at minimal costs. Having quality vaccines builds trust within the community, since it ensures the effectivity of the vaccination campaigns. Since 2012, it was able to deliver 19 million vaccine doses to more than 28 countries. In the Philippines, some local government veterinarians are providing additional services of pet microchipping as part of vaccination campaigns. This makes it easier to track vaccinated dogs and own dogs. It also has the capacity to reduce impounded dogs, since dog ownership is easier to trace. Rabies surveillance should go hand in hand with dog vaccination to be able to track the progress of a rabies program. GARC provides a comprehensive surveillance system called the Rabies Epidemiological Bulletin, wherein national governments can share data from the veterinary and medical side to facilitate accurate data reporting. It provides real-time interpretation of data. Indicators are aligned with the requirements from the OIE and the WHO. Components include data reporting on dog vaccination, PEP for humans, rabies cases in both animals and humans, and the community-based rabies surveillance. To monitor the progress and impact of dog vaccination, it is important that mass dog vaccinations are reported in real time. Rabies Vaccination Tracker supports planning and actual implementation of vaccination campaigns through high-resolution maps, informative graphs to estimate vaccination coverage and track individual vaccination efforts. It can be also used for dog population survey, which can serve as basis in estimating dog vaccination coverage after campaigns. Other organizations also provides mobile applications for this, such as Humane Society International and Mission Rabies. Community-based rabies surveillance is a One Health approach to have an early warning response system which capitalizes from information coming from different sectors. This provides real-time data and real-time reporting and sharing of information between field veterinarians, laboratory diagnosticians, health personnel from the bite centers, and the community health workers to be able to detect rapidly high-risk bites as well as highly suspect dogs, so that the dog-to-dog transmission and dog-to-human transmission can be prevented. For this project in the Philippines, the private veterinarians are also part of the reporting system and trained on the less invasive way to collect brain samples for laboratory testing. It is important that the public has the proper health-seeking behavior, and it is important that they are aware of the key messages on rabies, such as on the importance of dog vaccination and bite management. For World Rabies Day this year, we've developed a children's storybooks which highlights that vaccinated pets, especially dogs and cats, are the superheroes against rabies. Previously, we developed different animated videos for children, especially on animal bite management and reporting to parents any biting incidents. It's also important that the communities are provided with education materials and lectures, especially on how to deal with biting animals, that they shouldn't be killed and observed for 14 days. Last year, together with the National Rabies Committee and led by the Department of Education, we were able to integrate rabies in the national curriculum, which means that children from kinder, which are around 6 or 5 years old, until they are 16 years old or in grade 10, have knowledge about rabies. It is integrated in a different lessons, such as in mathematics, values education, health, science, so that children would know key messages such as on bite prevention, bite management, rabies as a disease, and that one is the most important also is that they would be raised and grow up knowing that pets are considered as part of the family. Together with the Philippine Animal Hospital Association, Philippine Veterinary Medical Association, the Bureau of Animal Industry and Humane Society International, a video was also produced to tackle on the misconceptions about rabies and that usually affects also dog vaccination in the field. World Rabies Day is a celebration of the progress, achievements of the different national governments, local governments, and at the global level in the fight against rabies. At the local level, there usually are vaccinations, sterilization activities for dogs and cats, and we hope that you could be part of these activities and be our rabies champions. So in behalf of the Alliance for Rabies Control, I would like to say thank you. Maraming salamat po.
Hi, I'm Natasha Lee, and I'm representing the Animal Wellness and Welfare Committee to present on the role of vets in dog population management. So I'll begin my presentation by introducing to you the ICAM Coalition, or the International Companion Animal Management Coalition. This coalition is made of several different international organizations with lots of knowledge and experience in managing dogs and cats population management programs worldwide. So all these organizations have come together to share their ideas, share their experiences, to discuss issues, and to provide guidance so that we can make dog population and cat population management programs much more effective. So one of the guidance that was developed by the ICAM Coalition is the Humane Dog Population Management Guidance. This guidance was first drafted in 2007, and in 2019, which was last year, it was updated with more recent findings, scientific findings, evidence, and different experience from the partners that we all share. Aside from this guidance, the ICAM Coalition also have a document called Are We Making a Difference?, which guides organizations to monitor and evaluate their dog population management programs. Now, if we compare the ICAM guidelines with OIE's stray dog population control, we see that there are lots of key principles that are aligned. But in addition to that, ICAM has an emphasis on two additional principles. First of all, it is the focus on root causes. And the second one is a focus on how to get the DPM programs sustained and adaptive. So in order to focus on the root causes, we really need to consider the entire dog population dynamics, and it's not a very simple issue. It can be very complex. So it's not as simple as we just only have either stray dogs or owned dogs. There's lots of ranges of different types of ownership in between, and there's also lots of different types of dog movement within your dog population in that community. So we need to look at the long term. We need to look at in the future. It's not just solving the stray dogs of today. We need to look at for tomorrow and in the future, where are our sources of dogs could possibly come from, and we need to think about how we're going to target that. That means DPM is not just solving today's problem. We need to look at tomorrow's possible problem, and we need to think of solutions that can be sustainable. So a slightly different way to view DPM is not to look at it as one problem that we need to solve once and for all. But as long as there are people keeping dogs, then we will always need to be able to manage dog population, just that the dynamics have changed. So we need to look at DPM as a permanent community service. We need to look at it a very long term. And things will change along the way. So the way we approach things, the way we look at what is more important will change according to your change in the dog population and its dynamics. One of the important things to highlight here is that the fundamental DPM service includes access to veterinary care and access to reproduction control. And this is where vets comes in. To simplify the graphics of dog population dynamics, we look at the influences that could change dog population sizes. Now, a lot of emphasis in traditional dog population control has emphasized on removing those dogs from the streets in order to decrease the dog population. But a different way to look at it is we need to shift our perspective and look at the ways that could possibly increase the dog population size. This means that we need to look at how we can stop animals being born onto the streets, or we can stop animals being abandoned. And a lot of this abandonment is caused by owners, irresponsible owners who breeds unwanted puppies. So sterilization is very, very important if we want to look at focusing more on the causes that could increase the dog population size. But the thing is, sterilization should only be done when there is good veterinary standards. That means that there's good standards for anesthesia, for pain management, asepsis, surgical techniques, and including post-operative monitoring as well. In order to be really much more effective with sterilization is to look at your targeted population and think about which population is more important for us to sterilize. And this will change from different community to different community depending on the dog population dynamics. The three most different dog population that we need to target would be dog owners, especially irresponsible dog owners, the unowned dog population, or the community dog population. Targeting dog owners. A lot of vets are already targeting responsible pet owners. Now, if you are a responsible dog owner, automatically you will be seeking a vet to get your dogs neutered, or at least some way in terms of preventing your dogs from breeding. But the important thing we need to ask is, how do we target where the dogs are coming from? So who are the potential irresponsible owners who keeps on breeding these dogs? And what are their barriers to sterilizing the dogs? Is it ignorance? Is it funding, economic? Is it the location, accessibility, or bad past experience? So all this could contribute as a barrier to preventing them from sterilizing their dogs. So we need to work together in order to overcome the barriers. So here's a list of different veterinary stakeholders that could help in overcoming some of those barriers. For example, we can work with vet schools to increase skills in DPM or in sterilization, or we can work with vet associations to increase public education, to coordinate with private vets, especially if we want to do outreach clinics to reach different communities that doesn't have good access to veterinary care. We can work with veterinary authorities, for example, to make certain drugs available and affordable, especially if we want to have low-cost sterilization. And we can work with individual vets itself. This will directly increase the capacity of veterinary services that we provide for DPM. Skilled vets can provide training from other vets or vet nurses or DPM teams. And we can promote within vet specialized clinic for low cost but high quality spay and neuter. So I'll talk about this in the later slide. So some examples where we can work in order to increase more sterilizations done. So I'm going to give you examples of different models. The first model is doing outreach clinics. Now this is important, especially in areas where there's not that much access to veterinary services. And this, we can also utilize lots of volunteers or part-time vets or staff. But the thing with doing outreach clinic is that it needs a lot of coordination. So there must be someone responsible to coordinate different human resources, different equipments and drugs that are needed, taking appointments or looking at where vet services are needed. On the day of the outreach, there needs to be flow management, and then after the outreach, follow-up care. So all this takes a lot of coordination work. I'm sure some of you have seen photos like this, outreach clinics in the US, for example. They have massive outreach clinics where they can do thousands of animals within a day or two. And here they utilize a lot of volunteer vets. Then they can do many different surgeries all at the same time. And it looks very high quality and high standards. But it doesn't always have to be that way. We can also do it in maybe a not so high-tech settings, a bit more low-key settings. But the important thing is, as long as we maintain the standards that I've mentioned before, so maintain good quality anesthetics, pain management, and so on, we can do it almost anywhere. It's easy to set up almost anywhere. Another model is the CNR teams, or catch, neuter, and release teams. Now this team, the main focus is to look at roaming dog population, where the dogs are caught, sterilized, and then released again. The key principles of catch, neuter, and release is that firstly, the dogs must be released in the same location, because releasing in another location will bring a whole different set of welfare issues. The teams need to consider whether they're doing a same-day release protocol or being kept in kennels for a few days to monitor post-operatively. Both ways are doable, but it needs to be a proper follow-up procedure needs to be implemented in order to make sure that there's no complication that arises from the surgery. One thing that's important with CNR is community engagement. So the community needs to be supportive with this kind of teams to work and for this kind of method to be effective in your DPM program. Now the last model that I want to show here is a private spay and neuter clinic. Now this clinic can be set up and is specialized doing only low cost but also high quality sterilizations. And it can be a potential veterinary business, so it doesn't always have to be charity. So even though you provide sterilizations at a low cost, profit can still be made because what you're doing is you're doing one thing, but you're doing one thing very well. So you do it very fast, and you can also have that volume to make up. You can buy your equipment and drugs and supplies in bulk, so you reduce the cost that way as well. And because you're only doing one type of services, the type of equipment and types of drugs that you need, you don't have to have that whole range as a normal private practice. So it can be much more limited and therefore save on cost. So therefore it is a model that you can think of. And doing high volume surgeries doesn't mean that it has to compromise on quality. So we can keep records to prove that the outcomes can be quite good or even better than a lot of private veterinary practices. So you look at the mortality rate of different either outreach clinics or CNR teams or permanent spay and neuter clinics, and they can achieve mortality rate that is very, very low. And we have come to the end of my presentation. So in summary, I would like to say that the ICAM guidelines has an additional emphasis looking at the root causes, looking at how we can make DPM sustainable and adaptive. And we need to change mindset to look at DPM as a permanent community service, not a one-off solution that will solve one problem once and for all. And we need to increase sterilization because that's essential for DPM, and this is where vets comes in. We must have very good veterinary standards in order to do that. We need to look at suitable targets for sterilization, and this can change according to the needs of different communities. We need to work with veterinary stakeholders to overcome barriers and increase the capacity for sterilization. Thank you.
Good day, and thank you for joining us in this webinar. I am Ray Del Napoles, the former Country Director for the Humane Society International and currently elected the Council for Technical Standards in Companion Animal Practice for the Philippine Veterinary Medical Association. Philippines initially ranked number 4 worldwide to have the most rabies cases. Since 1999, the Philippines has been yearning to be rabies-free by 2020, according to Wallerstein. It can be noted that the human population of the Philippines at the time was recorded to be at 77 million. Sadly, the Philippine government estimated that there were only 7 million dogs in the country, which is less than 10% of the human population. In 2016 to 2017, Humane Society International conducted and submitted to the national government a series of dog population surveys across the country. It can be noted that the average dog population in the country is within 17 to 25% of the human population, contrary to the earlier reports. In details, highly urbanized centers has lower dog population as compared to the rural areas. That is 17% versus 20 to 27%. In the absence of a baseline of the dog population, the government has no effective guide on how to conduct their vaccination drive, as evident in the summary table taken from the vaccination campaign in Payatas, Quezon City. A pilot study made in 2017 in the same barangay, a mass dog vaccination drive was made. The result was plotted against the vaccination coverage made by the local government since 2010. As illustrated, in 2010, they only have done 688. In 2011, 88. 2012, 2,094. 2013, 1,622. 2014, 3,867, 2015, 4,081, in 2016, 11,161, and in 2017, a total of 16,121. In 2 weeks, the team was able to vaccinate 59% of the dog population in the said barangay. It can be clearly noted that without establishing a clear baseline on the dog population, the local government has no way of determining how much the population they have vaccinated over time. In comparison, based on the estimates that was done by the Humane Society International, there were 27,321 dogs. The government estimated it at 13,359. Aiming for 70%, that is equivalent to 19,124 and 9,351.9, basing on the 13,359 population. With the vaccination that was conducted, HSI reported to only have done 59%, and that number is equivalent to 120.67% using the 10% of the human population. This table clearly illustrates that there is a big discrepancy in using the old formula of 10% of the human population. In 1999, the coordinator of the rabies program for the Department of Health reported that many people still believe that rabies is only transmitted by bites from stray dogs. In fact, 88% of the infections are caused by pet dogs and 2% by cats. This data was further supported by the dog population dynamic study conducted by WAP in Sibonga, Cebu, and Humane Society International. They reiterated that there are no stray dog population, but instead own dogs that are allowed to roam. What can be done? The government needs to invest on a reliable delivery method for the rabies vaccine. Establish an accurate dog population to serve as baseline in determining goals for the vaccine coverage, and invest in an effective and humane population control, and that is spay and neuter. In 2015, the Philippine Animal Hospital Association took an active role in the Wasaba outreach in the high-end stricken areas in Leyte. They conducted a series of spay and neuter drives together with the Humane Society International. Thereon, the organization has supported spay and neuter programs of different local government units such as Makati City, Muntinlupa, San Pablo, Cagayan de Oro, Dagupan, Quezon City, Cebu City, Taytay Rizal, Cavite, among others. In 2016, the Philippine Animal Hospital Association institutionalized a spay and neuter training program aimed at providing skills to private practitioners so that they can augment the manpower needs for the local government unit conducting spay and neuter drives in the country. Close to 200 vets are already trained, and several others are waiting for the training program to resume. The training was initially conducted in Metro Manila in Del Sal Araneta University, and then on to the Virgen Milagrosa University in Pangasinan, Southwestern University in Cebu, and Central Mindanao University in Bukidnon. In conclusion, vaccination of 70% of the dog population is a priority to completely eradicate rabies. This has to be coupled with a verifiable dog population survey and effective vaccination method. Dog overpopulation must be addressed through spay and neuter. Private practitioners should reach out and support their local governments in providing this program to the pet owners wanting to get their pets fixed. Thank you very much, and I hope everyone has a good day.
Hello everybody, my name is Luc Skoman, and on behalf of FAO ACTAT Indonesia, I would like to give a presentation on Bali Rabies Eradication Program. A decade of rabies in Bali, lessons learned for rabies control and eradication. Bali had been historically rabies-free, but then rabies was introduced in 2008. Over the last decade, the Indonesian government, together with other stakeholders, has implemented control and elimination activities with the aim of re-securing Bali's freedom from rabies. FAO has been involved in rabies control and eradication programs in Bali since 2011. This slide shows what happened over the last 10 years with rabies. It was introduced in the south in 2008, but after limited and local kind of control activities happened, that was not successful, and then it started spreading in 2009 and had spread all over the island in 2010. In 2011, control activities were enhanced and there was a huge reduction in cases. But then there was a surge again in 2015 after the use of a less efficacious vaccine in 2014. 2016 control was enhanced again, and then it was reduced in 2017, but it's still at a low level and is still far away from eradication right now. As for the strategies, there's the mass dog vaccination campaign, integrated bite case management in relation with rapid response, dog population management, and the creation of public awareness. As for the mass dog vaccination, that's implemented annually, island-wide, by the local government with the support from central government and FAO. It's aiming for 70% vaccination coverage of the 500,000 Bali dog population. After the campaign, there's additional strategies for sweeping vaccination of puppies and roaming dogs, and of course emergency vaccination as a response to rabies cases. On the graph below, you can see the blue line, how cases reduced from 2010 to 2014, and then the surge in 2015, going down with enhanced efforts in 2016, but still at a low level at the moment. The orange bars reflect the annual mass dog vaccination campaigns. As an important part of the mass dog vaccination campaigns, we have the A teams. They are in the front line of eradicating rabies from Bali, mainly focusing on remote rural areas, and these vaccination teams are known as A teams. There's a vaccinator, a recorder, and 4 dog catchers. The teams are searching villages and remote mountainous areas for roaming dogs. These A teams work in addition to center point and house-to-house vaccination during the mass dog vaccination campaign, but are also active between mass dog vaccination campaigns. Vaccinated dogs are marked by red colors. Another part of the strategy is the integrated bite case management. IBCM was first established in Bali in 2011, which then was introduced in 2016 after the surge in cases in 2015. IBCM is a protocol to enhance networking among the animal health and the public health sector and promote coordination of rabies control activities. As such, IBCM is a very good example of One Health in action. Advantages of the IBCM are improved coordination and communication at field level, increased response to bite cases, increased sample submission to animal health laboratories, improved human case management, and improved surveillance activities of suspect rabbit cases. On the left-hand side, you can see the protocol or the flow chart, how the human health and the animal health sector are working together in sharing information and follow-up on bite cases both from the animal and the human health side. Another part of the strategy is dog population management. Dog population management was piloted in several villages in Bali. On the left-hand side, you can see the 8 components of proper dog population management. Part of these 8, the ones with the 3, 6 out of them were piloted in Bali. They focus on community empowerment and educating communities on the risk of rabies and available control and prevention measures. They promote responsible dog ownership. They support village health workers and back up the local law enforcement. The results show that an increased public engagement and awareness of rabies risk in the community fostered some better communication with veterinary and public health officials and staff, leading to increased dog vaccination coverage. These are some pictures for the dog population management. On the left-hand side, you can see women groups at primary health centers explaining about the risk of rabies, what to do in case of bite cases, and what the importance is for improved rabies control. On the right top, you can see the registration of dogs in the village to have a better understanding where the dogs are, so that you can reach them when you do your vaccination campaign. On the right bottom, you see village elders preparing the village legislation how to improve rabies control at village level. Another area which is very important is creation of public awareness. And one of the focal points, I think, are elementary students at primary schools, just to explain them about the risk of being bitten, what to do when you are being bitten. So they have games and simulation exercise at the schools, and they are also informed about the importance of vaccinating the dogs. And they have close relations with their dogs, so they bring their dogs. So we use this with elementary students, but also with communities and culture and religion groups at local level. Even if most of the vaccination exercises are being implemented by government, veterinary practitioners under the IVM have been involved in the rabies program in Bali as well, for puppy vaccination, dog sterilization, but also for public awareness. Some of the lessons learned: annual mass dog vaccination campaigns are very important. There is a need of high quality vaccines, high efficacious, long lasting immunity. Sweeping vaccination for puppies and roaming dogs. Emergency vaccination is important, but it's often too late. IBCM protocol to be followed up. Dog population management is definitely to be implemented. Rabies public awareness. And dog culling is, of course, not advised. It's not part of the strategy, but it's still happening. Roaming dogs were culled in the first outbreak when rabies was introduced in the island, but it failed to stop the rabies spread throughout the island. Since then, it has been going on at a low level, but it never completely stopped, especially if there are human cases do occur or if the large dog population increases. It normally results in backlash of support from the community, especially if inhumane methods are being used. Culling is ineffective, as it might even reduce the number of vaccinated dogs because there is no discrimination between vaccinated and unvaccinated dogs. As such, the conclusions after all these years is that comprehensive island-wide mass dog vaccination should be conducted annually with high-quality vaccines in all villages in as short a time as possible, reaching a 70% coverage. Supplementary vaccination should target puppies born after campaigns and unvaccinated dogs missed during campaigns involving all sectors, including private practitioners. Emergency response vaccination should be implemented quick enough, but also at a sufficient radius of the risk areas. Further ones are targeted surveillance through IBCM coupled with increased public awareness, is a sensitive and efficient way to increase case detection. Dog population management, implemented to encourage responsible dog ownership, with a focus on vaccinating dogs, particularly puppies, to maintain high levels of vaccination coverage. Creating awareness for children and students is effective to send messages to their parents and their communities. Culling dogs is not recommended. It's ineffective for rabies control and it undermines the development of a longer-term solution. As my last slide, options to enhance rabies control in the future. Increased puppy vaccination should be followed up, involving private practitioners and IVMA, as many of the positive dogs are actually puppies. Oral rabies vaccination should be piloted for roaming and hard-to-catch dogs, and we are planning to do that. There should be an increased community involvement, and there should be an expansion of the dog population management and responsible dog ownership to the whole of Bali. On the right-hand side, you can see the picture of children at World Rabies Day in 2019, declaring that Indonesia should be free of rabies by 2030. Thank you very much.
Hello and welcome to the live Q&A part of the webinar. Thank you for being here. We have Sarah and Nat, who very kindly were part of that presentation. And we've had a couple of questions come in on the webinar chat. We've also had some other questions come in prior to that. And I'll direct the first one at both of you, but maybe firstly at Nat. And it's from Joel in Portugal about the obligatory status of rabies vaccination for dogs only and not other domestic pets. And he asks, do you consider that this could be contributing to a false sense of security in terms of community and I guess individual protection? And the other second part of that question is, only animals that are microchipped can be vaccinated, and is it a good idea to link the two together? No?
Thanks for asking that question. I think that question is really a very good question. I'll answer the first part first regarding the vaccination of dogs and other species. As you know, according to statistics, there is two types of rabies that's going around. One is the dog-mediated rabies, which affects 95% or more of human death around the world. That's why our main focus is on dogs, because they are the reservoir for rabies. The other set of reservoir for rabies is normally in wildlife, and that's a whole different strategy in terms of how you manage wildlife rabies. So for when there's dog-mediated rabies around and a place that says endemic for dog rabies, if dog rabies goes out of control, so you have many cases of dog rabies, you start to see rabies in other species as well. So that can include cats, that can include maybe livestock. As long as they are mammalian species, they can get rabies, and technically they can also infect other people and other animals for rabies. But these other species are what we call spillover species. That means that when there's enough density in the dog population, then you'll see it in other species. So the main focus is really still the dogs, but at the same time, we need to understand that, for example, cats, they are very close to humans, so they are another companion animals as well. So when you have resources in your country to do rabies control, you can also focus on cats as well as dogs. But the main thing, especially limited resources, is on dogs. And your second part of your question is also another good question regarding the link between microchipping and identification and also the vaccination. In a way, it's very good because you get to trace the animal, you get to understand the history of these animals, how many times the animals were vaccinated, when was the last vaccination, and so on. So that is very helpful information for you to get in a rabies control program. But if you're at the end of the day, it really depends on the strategy that is more aligned to your community. So if microchipping is one of the things that the community don't trust, then you might want to leave out that part and find out other ways that you can identify and differentiate between the vaccinated and non-vaccinated animals.
Okay, thanks, Nat. Sarah, there was a question directed specifically to you from Deborah in Scotland, and it's about the demographics of people who take up the community coordinator certificate that GARC, I believe, is running or responsible for, particularly gender, age, professional background, etc. Do you have that information available?
Thank you, Shane. Thank you, Deborah, also for that interesting question. We know so far that we have around 800 graduates of the Community Coordinator Certificate. We have in our data, and we can get it for you. Maybe we can discuss it at a later time of the age, the country, and their professional background. But what's interesting also on the GARC education platform is that it's not only for vaccinators or the specific professions, but even my veterinary professors, veterinary students, village health workers are taking this different education resources so that they could support the vaccination or any rabies program in the field. Thank you.
Okay. A couple of other questions, and Yol's come back with another question relating to microchipping. We'll get back to that if we can. A question on puppy vaccination. Should puppies be included? Puppies, in this case, is referring to animals under 3 months of age, be included in the vaccination program, seeing recommendations to vaccinate above 3 months of age. Would you like to answer that, Sarah?
Thank you for that question, Shane. The WHO guidelines provides that the 3 months vaccination is more because of the maternal-derived antibodies, but especially for those that are free-roaming dogs, where we question the vaccination status of the dams, we don't know. So usually, the WHO guidelines provides possible vaccination at puppies younger than 3 months of age. In Indonesia, it depends on the national guidelines that they use. In Indonesia, they vaccinate as early as 2 weeks of age. In the Philippines, they allow at 6 to 8 weeks of age.
So there's no harm in doing it at a younger age? And is there any protection, assuming there is no maternal immunity, does it provide protection for the puppy?
Yeah. Preferably for others, they recommend that they vaccinate again at 3 months of age, just to have that booster shots also. There's a question also that, especially if it's a free roaming and it's not dewormed and it doesn't have that correct nutritional, they're not getting the proper nutrition that they need, that having that protective antibody titer, having a protective antibody titer after vaccination is a question. But if we are in a highly endemic country, sometimes you have to take that risk also for vaccination. Maybe Natasha can also have some views on this.
There are studies which shows that whether the puppies has maternal antibodies or not, that any vaccination can induce some sort of immunity. So when you have a rabies control program, you actually want to have, even though it's a little bit of immunity, it's better than nothing at all. So it's better to cover all your puppies in your vaccination program. Of course, if you can get to it when it's at 3 months old, it's better to revaccinate to make sure that they actually do keep on producing that antibodies.
Okay, thanks. Thanks for that, Nat and Sarah. Now, another question here is, what is more important for rabies control, vaccination or neutering, or let's say dog population management, as we know that neutering takes more time and more resources to do? So, Nat, do you want to start with that one?
Yeah, sure. That's a very good question that a lot of people who run both rabies program and DPM programs, they keep on asking. One of the things we need to really consider in a rabies program is how fast we can do the vaccination. So the faster we can cover the area where we vaccinate 70% of the dog population in that area, the better it is for our rabies control strategy. But when we do neutering at that same rate, we take much longer time. So instead of covering that area in maybe, let's say, 1 week or 2 weeks, when you include neutering, it might take a couple of months before you actually covered 70% of the dogs in that area. So you do want to prioritize the rabies vaccination, and if you have other resources, you can also do some neutering, but the priority really should be in rabies vaccination for a rabies control program.
Sarah, do you want to comment on that?
Thanks, Shane. As mentioned by Nat, I just want to echo that mass dog vaccination remains the best, most cost-effective way to control the dog-to-dog transmission, and the dog neutering can be a way to supplement that that program, especially in decreasing the turnover of the dog population within the community.
Okay, all right, thank you. Another couple of questions we still have before we get back to that one from Yoel about microchipping. It's how can private veterinarians and particularly small animal or companion animal practitioners support rabies elimination? Sarah, do you want to start with that?
Great, thank you, Shane. I think I'm basing it based from our project sites in the Philippines and some in Indonesia. It's that private practitioners play a great role, especially on rendering their services in, as Nat has mentioned, also the high quality veterinary services, especially in neutering campaigns. That's one thing also, and also volunteering their services during mass dog vaccination campaigns, or even training young veterinarians, veterinary students to support the campaign. And they have the clientele also to support information campaign, and even as parents or as private individuals to share the information about rabies.
Yeah, I just want to add on top of what Sarah has mentioned, that vets is maybe your first round of investigators, you can say. So they get to see rabies cases if it's presented to them. So they are very important part of a surveillance program, and there has to be a clear reporting. So if they see suspected rabies cases, who do they report to? What kind of samples do they take? What kind of advice they need to give to the owners who bring those animals into their clinic?
Okay. A couple more and we get back to our last question. I hope you don't mind staying for a little bit longer. We're just about out of time here. It's a question about frequency of vaccination. So do we need to do yearly vaccination if the vaccines can induce a 3-year immunity? And I guess there's got two components of this, whether you're talking about an animal owned by a private individual who's bringing it to a veterinary clinic, or whether you're talking about a mass dog vaccination program, whether they're roaming or community-owned dogs. Nat, do you want to start off?
So it's a good thing that we actually now have vaccines that has been proven to have 3 years immunity. But when you want to do a mass vaccination program, your main goal is actually that percentage coverage of your dog population. So you want to have that 70% of your dogs in that area vaccinated at any given point in time. So therefore, if you are doing a revaccination campaign, you actually want to do as many as you can again every year, or in some cases even faster than a year. Depends on your turnover, the dog turnover of that dog population, really. So it's advisable, even if you have vaccinated a dog last year and they come to your vaccination campaigns, you include them in your vaccination again. You don't want to have that chance for it to not have that immune response that you want.
Okay. We have another question that's come in from our audience from Marapi, I hope I pronounced that correctly, and it's saying that with a large number of mass sterilisation programs that are being done all around the world at the moment, there may be the possibility of compromising standards, and that was addressed. You addressed that, the different standards with anaesthesia, analgesia, pre and post-op care, etc. How do you, and because this is a very important component of animal welfare here, how do you propose that these be addressed? And I guess you can look at this in two ways. One is a global overview of what should be done, and maybe at an individual level from both the people doing the program, the sterilisation program, and people who are advising that program.
So I guess it really depends. Firstly, we have to look at who is overseeing what is being done by vets in that country. So the first thing we need to look at is whether there's any place that we can report some kind of malpractice if that is going on. So that's one thing. And then the other thing is whoever's running the program needs to take that initiative to actually learn more about what the different standards are and why we should not compromise on those kind of standards. So there are different guidelines that are available out there. So WSAVA Animal Welfare Guideline is one example that you can take if you have a clinic that you run. But for neutering standards, there are also various different organizations that have that says that this is the minimum standards that we need to go, because when we are doing things, we are doing for animal welfare. So we need to make sure that the whole process should be good welfare, good experience for that animal throughout that process.
Thanks for that. Sarah, do you want to add anything to that?
I think also that's where WSAVA comes in with the national, as Nat has mentioned, with the national organizations, and looking also at the field level of what's been happening, if this is up to the quality standards also. So like in the Philippines, we work with the Philippine Animal Hospital Association, Philippine Veterinary Medical Association, and like Humane Society International, working together to ensure that, you know, the proper surgery techniques are being done even at the field level.
Okay, thank you. We've got a couple of questions, and then if we can, we'll get back to that last question from Yoel. There was a question about if you happen to be able to control the rabies in your particular area, but there is incursions of rabies from outside, possibly even across international borders, as possibly may have been happening in Sarawak. What can we do to help prevent this? And I guess we means the community in general, as well as governments and veterinary bodies. What can we do to help decrease the introduction of rabies into free areas?
As we've seen that rabies is a transboundary animal disease, so it needs a collaboration not only at the global or at the national level, it has to be at the regional level, and looking into it's an early warning and rapid system response system, and having that emergency prevention system, or in looking into possible ways that there can be an incursion within an area. The veterinary profession, medical professionals, knowing what to do in case there's a rabies case, and also it's very important that the public is still aware of rabies, even though they're rabies free, and that it doesn't only affect dogs, and it also affects cats.
Yeah.
I think it's also very important for adjacent areas to be prepared. So you have that preparedness. So getting ready in case rabies actually comes into your area. So one of the important thing is actually, you know, where you're going to get your supply of vaccines from. Will there be any legal barriers to get that vaccine when you need it very quickly?
So, for example, in Singapore, what we've had the government authority here doing buffer vaccinations around the border with Malaysia because they expected any incursion may be coming across. So, in effect, you say both of you be prepared for such an incursion as best you can. Okay, we'll have one last question from the list here, and then we'll go back to that one on microchipping if we can. And again, this is a very broad question, and I don't know how well we can answer this, but it is the goal of eliminating canine-mediated rabies from humans by 2030 actually doable? Can we achieve this? Sarah.
Yeah, I think this is an idea that we need also to, so we've had the global strategic plan, we have the regional networks knowing about it, and the chief veterinary officers, but at the same time, we have to also capitalize on those that are like local government veterinarians in the field that has been doing this for several years. But so it has to come at the national government. It has to be a priority. It has to be part of the policy and the budget to say that this is a priority, and it has to be once and for all that rabies elimination is a possibility. It has become, it's not only a neglected tropical disease, it has become a routine tropical disease. It's like, oh, it's just there. No, so I think there needs to be a game changer to say once and for all that 2030 is a possibility.
Matt?
We have so much data and more data coming in where there are lots of success stories in terms of getting rid of rabies or significantly decreasing rabies cases through mass dog vaccinations. And at the end of the day, it's not a matter of if we can do it, but how we can do it and how much we prioritize doing it. And again, it's not a one agency responsibility, it's a collaborative effort. So the more we can work together on it and prioritize this disease, I think it's really possible.
Okay, great. And because we've got 3 minutes that we can actually go back to that original question about microchipping, and the return question was about the microchipping when owners don't want to identify their pets, they won't get a rabies vaccination. So I guess this goes towards the legal standing or the legal requirements in each different country to start with. And the second thing is from a program point of view, or even from a local council or regional government point of view, how do you identify animals who are vaccinated from rabies if you don't have some sort of requirement from the owners? So Nat, do you want to start off here, please?
So microchipping is one of those ways to identify the dogs, and it links to the identity of the owner. But there are other ways where it doesn't really link, and you can use it to identify and differentiate between a vaccinated and non-vaccinated dog. So for example, putting a collar or making them wear a metal tag around the neck is one way that we can identify that this dog has been vaccinated and the ones without a collar is not vaccinated. So it still allows you to do a good rabies control program and focus on mass dog vaccinations. But it depends on at the end of the day, the community and the legal aspects in that community, what is required and what's not.
Sarah?
I'll just maybe share what we are experiencing currently in the Philippines, that the local government veterinary offices are now tying up with private microchipping companies, and they provide very cheap microchipping services. And this doesn't only, be able to monitor vaccinated dogs, but at the same time, at the surveillance point of view, it makes it easier to link the biting dogs with a bite victim. And it's also easier now to determine who owns the free roaming dogs. And instead of getting the dogs and putting them in a dog pound, you can just say that, oh, this is the owner, and give them a citation. So it makes life easier also, but it has to have that ownership also of the local government and even the national government.
So it comes back a lot to dog owner responsibility or responsible dog ownership, that people take the concern and care of their dogs and prioritise that. Okay, well, that's all the question we had. Thank you so much, both of you, for joining this live question and answer session. Thank you all for being part of our audience today. We hope you took away some useful information from it all. And we will see you at, I think it is 12 p.m. UTC for our second Rabies Day webinar 2020. Thank you very much.